Dear distinguished guests, honorable representatives, esteemed organizers and colleagues, welcome to this virtual lunch debate. It's a privilege to speak to you on the occasion of this year's World Hearing Day. This day reminds us that hearing care is not a private issue. It remains a public, a social responsibility. Hearing connects people not only to sound, but to community, to education, and to opportunity. According to the World Health Organization, over 400 million people live with this disabling hearing loss. By 2050, the number could double if we do not act. Yet, more than 60% of hearing loss cases could be prevented through public health measures, like vaccination, noise regulation, and early screenings. For too long, hearing care has stood on the margins of health policy. It remains our aspiration and our demand. It must move into the center. Actually, we can be proud of many achievements. In Germany, newborn hearing screening has become standard practice, and it's one of the most successful early detection programs in Europe. Across the EU, we now see progress on occupational noise regulations and accessibility standards in broadcasting and public services. Globally, several low and middle-income countries have launched national ear and hearing care strategies, a major step forward. WHO's Hearing Care for All initiative has brought structure and visibility to what was once a neglected field. But there are still major gaps. Less than half of countries worldwide integrate hearing care into their universal health plans. Many regions have fewer than one audiologist per million people. Even in Europe, the waiting time for fitting hearing aid can span months. We need systematic, structurally anchored solutions. At the national level, that means better integration of hearing health into preventive medicine and primary care. Hearing checks should be as routine as eye tests or blood pressure screenings. Public procurement policies must ensure affordable hearing technology. Reimbursement systems should recognize not only devices, but also rehabilitation, counseling and follow-up. At the European level, coordinated action can raise standards. The EU can support harmonized screening protocols, invest in hearing research through Horizon Europe, and strengthen accessibility legislation. Every digital platform, classroom and workplace should be accessible by design, with hearing inclusion as a baseline, not an afterthought. And at the global level, international cooperation must address equity. Affordable local production of hearing aids, training programs for audiologists and ENT specialists, and community-based outreach are cost-effective interventions with high social return. All this must be implemented even in the face of resistance and a noticeable social political rollback in many European countries. The current Zeitgeist, as we say in German, is irresponsibly shifting the problems into the future. Allow me to highlight one area where policy and practice profoundly intersect: early intervention and education for deaf and hard of hearing children. We know that identification must happen early, ideally with the first months of life. We know that over 60% of childhood hearing loss is preventable, but screening alone is not success. Children and families need pathways to support. That means national networks of pediatric audiologists, speech therapists, and early educators trained to provide differentiated communication options from sign language to assistive technology. In Germany, models already exist in some regions where hospitals, kindergartens and schools cooperate seamlessly. This should be the norm, not the exception. On a European scale, maintaining national early hearing intervention frameworks could ensure that no child falls through the cracks. Every child, regardless of hearing ability, deserves full participation in education and society. Early investment pay off through better literacy, social inclusion and lifelong employability. For healthcare professionals and the healthcare systems, this is also a matter of resource planning and service design. The demand for audiological services is increasing as population age. By 2050, 1 in 4 people over 60 will experience disabling hearing loss. We can and must prepare by expanding training capacities, embedding hearing checks in geriatric care and using digital health platforms to reach remote population. Teleaudiology and AI-driven diagnostics are not future concepts, they are solutions ready for implementation now. But an AI usage for common good, not for the privileged few. Let us ensure that primary care feel confident to identify and refer patients early. Let us make multidisciplinary teamwork between audiologists, speech therapists, psychologists and educators that gold standard but in practice. Investing in hearing care is not just compassionate, it is economically smart. The WHO estimates that unaddressed hearing loss costs the global economy over $980 billion US dollars annually through lost productivity, unemployed and social isolation. Preventing hearing care delivers an estimated return of more than $15 for every dollar invested. That should be a compelling argument for every finance minister, even in times of tight budgets. We can and should build national hearing strategies grounded in both ethics and economics. Our challenge is not the lack of knowledge, it is a lack of coordination. Let us align our efforts across ministers, medical associations, insurers, education systems. Let us share data, harmonize standards, and learn from successful case models. Europe has the means to do so, and we here have the ambition to make it happen. This debate is the ideal space to shape promising partnerships. Dear all, it's this saying that goes, hearing connects us to the world, but listening connects us to one another. I am convinced we do have the power to make a profound change. We can craft frameworks to protect, prevent, and empower. If we truly listen to the need of our communities, we will build a future where hearing care is universal, equitable, more affordable, and sustainable. Thank you for listening, and a huge thank you for making listening possible for all. This is how an inclusive future is shaped. Thank you.